Alicia, and hello everybody to the April 2025 CCO Club Q&A webinar. Hello Alicia again, and how are you tonight?
It's a fabulous night, doing very well, excited to see where everybody's from. So thank you for doing that, everybody, letting us know where you're from.
We got some Texas, we got some Pennsylvania. What else did I see in there?
Missouri,
Did you see?
fellow
Missouri.
Missouri, and I saw a little while ago.
Nice. I'm in Michigan myself, so shout out to Michiganders if you're out there. And we have a lot of stuff going on in CCO these days for club members and a lot of other people. We're working on actually CC optimizers for auditing. So that's going to be a new service that's coming out for us in the next couple months and helping those people who want to profit when they get audited, right? An opportunity for getting more revenue, put it that way.
Right. Looking for missed opportunities is the key phrase we say in the industry.
Nice. So just a little bit heads up on that. So I think we're ready to go, Alicia. If you want to get started, we won't delay this any longer and keep people past our 1 hour, hopefully, ETA time.
Sounds good. Well, we are in April for this webinar. And as you know, our CCO Club Q&A webinars are where we take questions from our club members and talk about what's happening in our industry and kind of unpacking it, I'd like to say, answering those questions, doing the research for you. The question that came up, this most recent batch of questions that we came up, I thought this was a great one. What if I want to get into the a medical-based career, but I don't necessarily know if I want to go into coding or billing? Are there other options? I want to be in the industry. And absolutely, there are some amazing careers that you can have in the medical industry where you're not a nurse, where you're not a doctor, or you're not a coder or a biller, where we talk about that pretty frequently because we offer courses in that. So we are going to look at some of the opportunities that you may not be aware of and maybe stretch your view of where maybe you'd like to go that you hadn't thought of in the past. And then we're going to talk about how to get there, some of those skills that are going to make you better, and exposure in the medical field, because there's a lot of dynamic things that you can do. First, we absolutely want to remind everybody, if you're not already a member of the CCO Club, it's real easy to get more information about it. You go to the cco.us/club, been around for many years now. And if you are a member, this allows you to get a complete package every time we do a webinar. You get the replay, you get a copy of the slide deck, you get a transcript, and you get further discussion. So this will go up into the CCO Club. And if you want to talk about things that you learned or have questions about what we talked about, that discussion can carry over in the CCO Club. So it's a great opportunity. Plus, there's lots of CEUs in there. Let's start by talking about the traditional versus non-traditional roles in the medical field. Now, when we talk about traditional roles, we think of doctors and nurses. That's the way it's pretty much always been. Then they expanded that where you could be a doctor and then you could be a physician's assistant, and you could be a nurse, but you could start out as an LPN or LVN. They're pretty much the same. The acronyms are a little bit different, but their role is the same. And then you could become an RN, and then you could become keep building that education and become maybe a nurse practitioner. And now it's pretty common. Nurse practitioners in some states can open their practice, put their shingle out, and be completely independent. Other states, they can open a clinic, but you're still supervised and under the authority of a physician. I kind of like to think of it as real estate. So in some states, you would still have to have a broker, and then you have the real estate agent out there. You're supervised by your broker. And then in another state, then you wouldn't have to have a broker. You could be an agent and broker all on your own. So anyway, that's kind of the way I thought of it. So those are the traditional roles that we think of in medicine. If you've ever had the opportunity to work in a hospital, you are acutely aware of all of the different people and their roles that make up and run a hospital. Now, some of those roles have, you would say, don't have a medical, they're not in the medical arena. So those would be things like housekeeping, and who also they would be housekeeping and sanitation, and then you have police officers, security, you have the people that make all the food, and the dietitians and stuff work with that. These are in engineering. Just some hospitals still run boilers and stuff, so that is and groundskeeping. Sometimes that's contracted out. Sometimes in entities, they're not big enough to a hospital may not be big enough to staff that role, so they contract out as well. So these are not clinical. You wouldn't necessarily have to have a medical background to be able to participate and be a part of the medical facility. Now, that's not the non-traditional roles that I'm talking about, but those are also roles that if you wanted to work in a medical field environment, there's a lot of great opportunities for you, and there's always a need for people that have positive attitudes, great work ethics, and need good insurance, because usually hospitals have really good insurance. But these are larger hospitals that have a lot of these extra areas. Clinics and doctors' offices, not necessarily, but some do. You may have a doctor's office that's a large multi-provider practice, but they wouldn't have a cafeteria. They wouldn't be delivering meals and so on and so forth. Now, I have been exposed to some of these large practices, though, that actually have a daycare attached. And so, again, the options are out there for you, depending probably where you live makes a big difference. But traditionally, the traditional roles in the medical field, we think of clinicians. So that would be doctors, PAs, nurses, nurse practitioners, and then you can have more non-traditional roles where you have ancillary staff like your therapies, OT, PT, speech therapy. You may have a cardiac wing where they have cardiac therapy, where it looks like a gym. I work for a hospital in the real estate department. There you go. That's pretty amazing. Yeah. So there's a lot of really cool roles out there. But today, I want to focus on some non-traditional roles that still you need a medical foundation, education based in medicine, but you don't necessarily need a degree to get into that role. Now, some of them you would, uh, for it, you could get your foot in the door without having that. So we're going to discuss that. The non-traditional roles are not just a support staff. Sometimes they're a major part of running the facility. And we're not going to focus just on facilities. We're going to focus on other opportunities as well. There's a lot of skills out there. There's perspectives helping to innovate and enrich healthcare systems alongside those traditional provider. So it's pretty exciting. And I really picked this picture specifically because medicine has changed. For one, we see more women than we used to see working in leadership roles. And that's not, I don't even think about it, seeing men and women together side by side, because in my lifetime, it was just a thing. But I think of my parents' lifetime, and you saw less women in leadership roles. And then before that, my grandparents, you probably never saw that. So that's one thing, is that we see a lot of, it shouldn't be dependent on if, you're male or female. But in the past, having somebody in a hospital with tattoos working in the medical field was a real taboo. And that is not something we see anymore. I have opportunities to be in a lot of different hospitals, and it is a very colorful environment now. So that taboo is kind of out the window. Not necessarily seeing maybe physicians with tattoos, but absolutely lots and lots of intricate roles with people that I saw a doctor with colored hair. It wasn't purple, but I was really surprised. She had a shock of colored hair. And so again, things have changed through the years, and that's kind of impressive that and I'm sure we're going to see those roles in what we look at as the uniform that a person wears as being traditional versus non-traditional. That's going to change. When I went in to the medical field, it was a very structured uniform. You always wore white uniforms, and RNs would wear white stockings, and um, if you were an LPN, you or any other role, you would wear stockings, but they weren't colored. They were natural color. And then the hats, the nurses always wore hats, and you could tell what university or school that they went to and graduated from because of their hats and the lines, the different lines and stuff. So RNs usually had a stripe of sometimes. So it is so there you go. I can't pronounce your first name, Mr. Reddy, but yeah, healthcare recruiter. Not only is that the opportunity to find people that are eager to get into the medical field, and talk about the different jobs, but that's also a job that you might be interested in. So again, times have changed and they will continue to change. I personally, again, my impressionable years were very traditional medical outfits, and I miss that. I like being able to look at someone and know where they were at. There for a while, when I worked in the ER, we had burgundy scrubs, and every floor of the hospital had a different color scrub, and like respiratory therapy, they were always in black, and you knew where somebody worked based on the color of scrubs at that particular hospital. And I appreciated that, because if you wanted to ask somebody a question, you knew you could see them, and everybody else knew. Now you don't see that very much. Maybe you do in some where the floors, the nursing staff all wear color. But again, there's a lot of change, and we will continue to see change as we move forward and new roles opening up. Now, career pathways in medicine, the importance that I want to get across is that it is flexible. There's a lot of flexibility, but it is a lifelong learning career path. You may not get that in other careers where you're always learning and your job is changing. You will probably wear multiple hats if you go into medicine. Academic preparation, you can get a degree in your chosen field. A lot of times you can get one degree that will open up doors for multiple areas. We see a lot of nurses take on administrative roles, compliance roles, auditing roles. So that is an education, public health education. but you don't always need a degree to be able to do that. I would say that certifications sometimes carry more weight because they show you have a proven skill. Now, the certification I think of sort of as, and it is, don't want to get off topic, but think of your certification as a trade, going into the trades, because you're proving that you have the ability to be able to do the work. Whereas a degree, a lot of times, that's not proving that you could actually get in the trenches and do the work. There was a big push in the early 2000s, I'd say all the way up to 2010, where they saw a huge deficit with nurses. They were graduating BSNs, these RNs that had academic knowledge, but they'd never started an IV. They'd never really gotten out there and given people shots. So they looked really good on paper, but then when you opened up the door to the facility or the clinic, they didn't know what they were doing. And it showed. So, not only did it, give a lot of burnout for people that chose that career path, but it also stressed out the infrastructure on having to, "Hey, I've got somebody that's qualified now, but they actually can't do the work that needs to be done. So we gotta spend 6 months training them how to do their job that they should have learned in school." Whereas a certification doesn't really do that. It's kind of the opposite. We're not gonna spend 4 years in academics. We're gonna spend less, but we're going to really drive home the ability to do the trade and do the work. Now, with both of these, though, you can absolutely specialize, and I encourage you to do that. Now, you can get a broad degree or a broad certification, but within that certification, you can specialize. So, my background is pretty diverse, but once I found what I really was passionate about, I started specializing down that road, and that ended up being in diagnosis. I really like the disease process. I enjoy the ICD code set, and that really played an excellent role in learning to audit. Now, most people think of audit as E&M, and that did and does play a role. However, the disease process and understanding all the components of that and the way that's documented opened up doors once I started specializing. And I work really hard to keep my knowledge base up. The essential skills, though, that are going to be imperative: communication. You've got to be able to work in a team environment, because always in the medical field, you're working in a team environment. You have to be critical thinker, and you have to adapt. I can't tell you how many times I've had a role in the medical field where I started in one role and thought this was my not necessarily scope of practice. I started to say that, but this is my job description. And 6 months later, "Hey, we're giving you this other hat. We need you to do this too. Oh, by the way, now we have an opening over here where we're not gonna hire somebody. We're just gonna put you in and train you there to fill that gap." And then next thing you're moving all over the place. I remember, in 3 years that I worked for this one organization, it was in home health. I think my desk location changed more than 6 times. I think it was 7 that I counted. And I am not a person that likes to change where I get into my little bubble. I like everything in a certain place. If it's chaotic, I like it not to be chaotic, but if it is chaotic, it's my chaos and I know where everything's at. So to have to move to another desk or another location, that just kinda grates on my nerves. And yet I had to do it, and it made me more adaptable and able to think outside the box a little more. So these are things that you have to be aware of when you're looking at a career path in medicine. If any of those essential skills are something that you identify in yourself that you need to work on, then that's something that you should start now building up that skill set. They often call those soft skills, but some of those to me aren't soft skills like critical thinking. You may think, well, I'm not really a critical thinker. I don't think very fast on my feet. It isn't that. These are skills. Critical thinking can be learned, especially if you're in a specific area. Time builds knowledge and wisdom. And linking yourself with people who are really good in a role that mentor you and walk you through it is going to be extremely helpful. And nowadays, you've got all of these electronic assistants that we used to have to get a book. Now it's at your fingertips to be able to look something up or get information on how do I do this, or if am I even interested in this, and you can read people's experiences. We couldn't do that in the past. We're going to look at several of the jobs that would not entail you getting a degree. I think that's going to be important because, again, a degree is a fabulous thing to have, and I encourage people to get degrees. However, I do want you to be aware that even while you're working towards a degree, there are positions out there that you could fall in love with and could get into pretty quickly. Now, do always take everything with a grain of salt when you see some of these advertised, because they are there's always a hook. There's always something, a clickbait or something to get you into a funnel. So do your research, and we've done a lot of education. You go out to the YouTube channel that we have, and make sure that you are vetting your sources. And in fact, in the CCO Club, you can ask questions and have you heard of this particular company or this organization? Have you run into this experience before? That is important to check out, and also make sure that there's up to date feedback wherever you're going. So if there's just feedback about, say, a school or a place where you think you want to get a certification, and it was 5 years ago since somebody has stated any feedback about them, you might want to second guess that. All right, so let's start with the first one. These are certified nursing assistants. They're CNAs. It is an excellent place to start. There is a caveat to that. I would tell you that this is a young person's job. Now, what you say is young may be different than what I say is young. I started out as a CNA. That's what I was going to school in high school, was to get that certification. So I got that before I graduated high school. CNAs can work in the hospital setting. They work in clinics, and a lot of times they work in skilled facilities. That's usually where you get your clinical training and your practice done, is skilled facilities. There's always a huge turnover rate. It's hard work. It is the reason I think it's a young person's career, is because it's physical. Now, is there areas where you could be a CNA and not have that physical component? Yes, probably. But for the most part, this is direct patient care. That means you will be assisting people in ambulation, and you will be helping people take baths. You will be assisting them to and from one room to another. And it's also a place where you will not want to be shy, meaning, I don't say talkative shy, but you're up close in people's spaces, personal spaces. So you've got to be able to do that. Plus, it takes a, a grade of mentality where you have to have a positive attitude. And usually, if a person needs a CNA or that particular assistance, then they're not doing well. So they're going to be grumpy, cranky, and so on and so forth. So, but that does not take long to get into that. And it is a huge stepping stone. It allows you to work in the industry and make a little more money, and you get great exposure. And I think that direct patient care is something that everybody that wants to go into the medical field should have to do. You will make a much better clinician if you choose to go that route, if you've had that direct patient care at that first rung of the ladder. Again, it doesn't take very long to get certified, and you can always find a job. There's always a huge need. Medical assistant is a little bit different in that you will get a certification, and they usually have a diploma program with that. Now they also you can get an associate's degree, uh, but not only are you qualified to do clinical aspects of patient care, but you learn administrative tasks. I've really seen a huge shift in the industry where before LPNs and LVNs were hired to do these roles, and now they're hiring MAs. MAs are sought after because again, they can do the administrative portion. They learn coding. They learn how to um, get people set up in the EHR and so on and so forth. Not just how to give a shot, take a blood pressure, how to work with dictation and become scribes and stuff like that. So again, it's a really sought after role. You'll never have trouble finding a job, and you don't have to spend a couple years in college to be able to do that. Again, medical assisting MAs, very sought after. Home health aide is very similar to CNAs, but a home health aide is not working in a facility. You're going out to a person's home. They a lot of times will give you on the job training, and you can get the certification is very much similar to the CNAs, uh, but you have what would make you really well at this particular position would be that independent personality. You've got to be able to navigate your patient population that you're given, and you'll see those patients again and again and again in their home environment. And so, whereas in the CNA, you're usually in a facility. Now, can a CNA become a home health aide? Absolutely, vice versa. Patient care technician, this is similar, but you'll work in a hospital. It's the verbiage that is different. So CNAs would also be patient care technicians probably, but the verbiage again is a little bit different, and it's a certification. A lot of times people that are going to nursing school will be patient care technicians. Moving up, EMTs, emergency medical technician. Now, this is a great area. I got my CNA before I was out of high school, and I did my time working in skilled facilities. I even worked in a skilled facility when I was in college. But I also, right after I graduated, because I got my EMT, and I did it over the summer. I actually did it before I was 18, and you have to be 18 to take the test. And my birthday, luckily, was one week before I took the test. And I worked in the emergency room because of that. And I got to work on ambulance, and it was a lot of fun. And then when I went off to college, I couldn't get a job as an EMT, but so I worked in a facility. So I had a CNA and I had the EMT, which knocked me up to the top of the rung for getting a job, and I got paid really well for a college job, and I didn't have to work fast food, and my hours were great. Again, these are areas where at the time I made enough money to be able to get a car and help pay for my schooling, and had a great time doing it. Working in the emergency room as an EMT was brilliant fun. Another area that doesn't take a long certification or schooling is a phlebotomist. Now, a phlebotomist is who goes in and does all the blood draws. Now, again, you can't be squeamish. You're going to be working with needles. And that is a position that is most often, you're going to find a lot of roles in the hospitals. However, you can also be a phlebotomist for different organizations where now if the doctor's office doesn't want to do the blood draws, they either have a room and this contracted out by another company and then you work for them, or you could besides the hospital or another entity, you uh, could be working in the doctor's office and hired by that practice to be able to do blood draws. So again, it's a really fun career, but I would tell you that there's a lot of walking involved. Even if you are working in a facility, like now you can go into some of the pharmacies and they've uh, got an entity has rented space so you can go get your blood draw there, which again, you may be in a small room, but you're on your feet a lot and you're bending over. You're constantly bending at the waist to do these blood draws. You have to have a specific personality because people are scared of needles. And so you have to think about that. Uh, can that be learned? Yes, it can with time. And you can get really, really good at it because I know there's a lot of people that are, they call them, hard sticks. And so I always appreciate having somebody that I know has been a phlebotomist for a while and talks about being, call Susan. She, if you're a hard stick, we're going to have Susan do it or something like that. So it's a little bit of prestige. I'm not a hard stick. So again, I always tell them, I used to let um, the MA students practice on me because I wasn't. Dental assistant, again, this is a certificate program. One of the advantages of being in the dental assistant is you're always going to have great teeth. You have access to a dentist, and that is not something that most people have. Um, I would say that that's an exciting field to get into. Job security is really, really good, and you sit down almost 90% of the time. But you are up in people's personal space. Dental assistants end up with their hands in people's mouths a lot, but you get to do some really fun things, meet some great people, and you'll have good teeth as a result of that. It's always handy to know a dentist. Sterile processing technician. Again, this is some of these other one roles you could start in, but and maybe work up to becoming a sterile technician, or you could go dive right into being a sterile technician. Again, it's specific training that you need to look for, but you will be working in OR suites. And there is a need for this where you set up the surgical trays, you make sure all of the equipment afterwards is in the right place and things sterilized. You have to keep track of all of that. So there's a lot of, not database, but you're going to be having to log in and log out, making sure supplies are full and that you have everything you need for all the procedures that are going to be done for that day or that week. So I think of it in the military, those guys that work in supply. So not only are you needing to have that medical training, but you are not only you're the supply chain as well as the person who sets it all up. It is your domain to make sure that the medical staff has everything they need that day to do the procedures that need to be done. Uh, Also, an area that means you're going to be on your feet a lot. So consider that. You walk a lot. We also have pharmacy technician. I did this as well. Really loved it. And I am so thankful that I got to spend, let's see, I did like 5 years at one for one entity, and then I ended up going away and coming back and doing another 5 years in another entity in pharmacy. Back when I did it, you were certified, but you didn't have to have the certification. Now you're required to have a certification. You can work in a hospital in the pharmacy, but you can, in addition, work at private pharmacies. One of the great perks, though, is working in the pharmacy. They have usually really good insurance, and you can work. I worked in a grocery store that had a pharmacy, and so and I never had a problem getting lunch. I got a discount for the grocery store as an employee. I got stock in the grocery store, and I also didn't have the long hours. Yeah, I was long hours, but I I had a set. The pharmacies only open a specific set of time, and it's usually never open on Sunday. Some are, and half a day on Saturday. So that was kind of nice. And the stuff that I learned working in the pharmacy still to this day is beneficial to me. So I'm really thankful that I did that. Again, it doesn't take long to be certified, and you can get certified sometimes while you're working on the job, and it pays relatively well. Downside, you're on your feet. Pharmacy techs do not sit down. So that is another thing to consider. Medical secretary and administrative assistant. These areas are office duties. Now, one of the cool things about these roles is you know everybody in the department. You get to see the people when they come in. So you see the patient as soon as they come in and when they leave. Now, you can also be an administrative assistant so that you could be working for so many different areas. Any of the specialties, and these are roles where you want to be real savvy with the computer. You want to be able to work Excel, all the Microsoft programs and stuff. So, and it's a sit down job. You might be pulled into meetings, and you want to have a positive attitude, absolutely, for doing this. But you sure learn a lot about all the workings in a facility or in the practice. And you end up being the go to person when somebody needs to get a hold of somebody or want to know what's going on. You are the kind of the keeper of the calendar. Medical records specialist, I also did this. And this is where I truly learned to read documentation. I had to put the hospital records together, and it was all loose paper back then. And it was a specific order. I got to read all of the documentation, all the tests that were all on paper, put it in an order. I had to deliver it to different departments, pull patient charts that would be multiple files. We had to take it on like a gurney cart to where it needed to go. And of course, now it's all electronic. But truly, to this day, again, medical records specialist, there's always a huge need for somebody to work in medical records. It is a sit down job, and it is something where you will get intense exposure to every document that passes through that hospital. Uh, Medical biller and coder, I've done that. And this is also something you don't need a degree for. None of these do you need a degree for. You can get a certification. It takes anywhere from 4 to 6 to 9 months to get that. Of course, CCO has certification. It will help you get your certification in coding or billing and the specialties. Just like some of these others, you can specialize. You can specialize as a biller, and you can do hospital billing, clinic billing. You can get into fraud and abuse coding. All the medical specialties you can tap into, as well as facility and private practice. And you get exposure to documentation, and you learn so much when you're doing this too, because you learn about the disease processes and all the new things that are happening in practices. So I enjoy specializing in ICD and working both in revenue cycle and coding, and you can always find a job. You can always find a job. It may not be super easy to get in the very beginning. You may want to tier and do some of these others, but once you get in, it's probably one of the best paying jobs you can get without a degree. So, um, it also determines where you live. And remote work is much more common than it used to be. In fact, it's really common now. But you do have to prove yourself. You start out as a newbie, and so you want to make sure your soft skills are really good. This is the last slide about the individual areas where you can get involved without a degree. Emergency dispatcher. Now, this is a sit down job. And I wouldn't necessarily say that this is a job you would want to have as a young person. It is an extremely stressful job. You do have to have a specific type of mental maturity to do this job. There will be times where there's some lag, but depending on who you work for, if you're working in a city or a large town, your whole shift's going to be on the phone. Whereas, smaller towns and stuff, it may be different. It pays pretty good, but it's intense. And I would say, one, you have to be real savvy with the computer. You got to type fast, and you have to be able to think fast on your feet. Now, these are all things that can be learned, and you have to be able to disengage, because when uh, not everybody has the ability. Some people are really hyper empathetic, and it's good to have empathy, but you also have to be able to disconnect with what's happening. So at the end of the day, when you walk away, you have to be able to separate your everyday life with what you're doing as a dispatcher. I've known some people that have done this. I thought maybe it would be something that I wanted to go into at one time, but I'm way too empathetic to be able to do it. And there's protocols, lots of protocols involved. So if that's the type of person that you are, if you need a sit down job, if you can type fast, if you can learn to think quick on your feet, and you go step by step on protocols, everything's laid out for you, what you need to do for every scenario that crosses your path. Excellent. And you make amazing friends in this industry with emergency dispatch. So that, again, may be something you might not have thought of. And there is a huge need for people in this role. Patient service representative. This is that front desk. I encourage a lot of people to do this, especially if you're getting your certification in coding and billing, because you learn what it takes from the time that patient walks in the office. You're the first person that patient sees. You're the personality of the whole office, and you see what can happen as the workflow down. It's a sit down job. It usually has set hours, and typing, you get to learn who everybody is in the facility or the clinic that you work in, but having a positive attitude and being willing to be adaptable, because you usually have to do a lot of different things while you're doing what was your scope or your job. They'll always be giving you other things to do. Great job to get into. It's absolutely a stepping stone to go higher, as a great job to have as you're getting certifications and other things. And a massage therapist actually doesn't have to have a degree. There is training involved. The reflexology and some of the other things, you really need to have a good medical anatomy, physiology. All of that is a huge proponent of this. It is a physically intensive job, very much in demand. And it isn't a taboo, kind of like what it used to be back when I was young. There is some great careers that have started as massage therapists, and then if you want to start getting into physical therapies and so on, and you can also specialize. When my husband was in college, I know some of the wives. There was a couple of them that had gotten this training and had a pretty good practice working, but we were in the city, so that helped. But it, I know people that routinely go and get massages because they have specific diagnoses that alleviates a lot of the pain that they're in. So that's really, really exciting. Now, um, I want you to also know that these roles really um, have a practical aspect of it. Some will be more suited for you than others, but I hope that it helped you think outside the box. A lot of these can be entry points into moving up to other areas. Get in, start one of these areas, and then put the feelers out and see if this is where I want to stay. You specialize, or do I want to branch out? You get exposure that you wouldn't have otherwise. So I think it's valuable experience. It gives you opportunities for advancement in all of these. And not a single one of these do you need a degree for, but you do need knowledge. So let's talk about some of those foundational skills that you need. Communication and interpersonal skills, you have to have the ability to convey information. You have to be articulate. Now, you may or may not be right now. And that is okay. You can learn these skills. And some of them are just things you learn on the job. But I will tell you that the number one thing you need to have is a positive attitude. Does that mean you have to have an attitude like me where I am um, I started to say rambunctious and, bigger than life type thing, or an outgoing personality? No, absolutely not. You don't have to. But you do have to be able to be clear and concise. You have to be able to do active listening. You have to be able to turn your mouth off. That's something I have to learn to do and I have to practice. You have to learn how to collaborate with teams, and you have to be able to work within a team that has multiple skill sets. So you can't be intimidated by sitting next to the physician in a meeting and or the administrator of the facility or the CEO, because they're going to cross your path. Uh, you and again, it's daunting at first, but it it isn't after a while. And all of those jobs that we just talked about help you develop those skills. So it is important to work on communication, work on those interpersonal skills, and there are ways to do that. There are so many things. There's books you can get. There's interactive tools that you can get. There's apps that will help you. You could take a um, college class that you don't have to pay for. Sometimes they have evening classes too, summer classes, maybe in speech or something that would help you uh, push out of your comfort zones, get into community involvement. That would be helpful. So again, they can be learned, but you need to have them and you need to be willing to constantly perfect them. Critical thinking and problem solving, uh, these are really important for those non-traditional roles. You have to be able to think outside the box, but you have to be able to stay in the box when you're told to. A lot of protocols involved in the medical field. There's a lot of documentation improvement, documentation period. You hear HIPAA all the time. You have to be able to work within an environment where information has to be kept private, and you can't be tripped up. I mean, you can't allow yourself to give out more information than you're allowed to, or be overly friendly per se, or be lackadaisical. There you're a professional, and uh, you have to be willing to learn, and that allows you to create the skills for critical thinking and problem solving. And again, there's YouTube videos out there. There's lots of great books that can help you with those skills. Foundation skills also would include organization and administrative skills. I would have to say that, I really like the fact that they say geniuses always have messy desks. And a lot of times when you walk into a doctor's office, their personal office, it's just crazy. Uh, but you need to be able to have the ability to find something on your desk when somebody asks for it, no matter what role that you have. You need to be able to be organized. If somebody asks you to get a document or to be able to provide information regarding something that's going to happen next week, or can you pull this stuff together, you need to be able to do that in every one of those roles that I said. The pharmacy, you have medication that comes in, like every other day in these big plastic crates, and you have to mark them off that everything that was ordered came in. Sometimes you have to order the medication. You have a program that does it for you, but you have to put that stuff on the shelf, and it's alphabetized, and it's alphabetized in generic names, not name brands. And so you have to have skills that will allow you to work through those. Again, they can be learned. Administrative skills would be the ability to schedule meetings, be able to keep records, and to work in workflow management. Be able to get things done in a timely manner. Technical and computer proficiency absolutely is a given in every single one of these roles. Not only in the medical field, you'll be working with EMRs or electronic medical records, but you have to be able to work outside when that doesn't work or when there's a hiccup. You have to be able to switch and put things on paper, because that does happen. Uh, a lot of these technical and computer proficiencies you can learn on YouTube. Epic is one of the biggest EMR systems. You can go out on YouTube and learn how to get in and get involved and be exposed to Epic or Cerner. Uh, I would learn all of the Microsoft programs. That's incredibly important. You need to use Outlook and be able, because a lot of health systems use Outlook, Teams. I use Notes. So again, very, very important. Some of the other foundational skills is leadership and team management. No one comes out of the box being good at this. I've had to work through the years to get better at it. My brain does not work well in a leadership role. However, I've learned to adapt. Everybody's personality is a little bit different. I have trouble focusing in and staying on task. But also, from a leadership standpoint, you want to be able to have empathy, like I said before, but not be so empathetic that nothing gets done or that people work. You have to be able to delegate tasks and work with a diverse group of people and personalities. Again, that can all be learned. And financial and budgeting skills, not only for personal financial and budgeting, because if you're going to school and you're trying to increase your knowledge base, again, you may not be making the money that you hope to right away, but you would be shocked how everything really boils down to the dollar when it's in, especially facilities. You may not think that your role is going to have that burden or overhead, but it will be talked about. And there's fiscal budgets every year, and they come out. They start planning at the halfway mark, and you have to be able to stay within budget for the department. And so you will be called to be in these huddles and these planning meetings if you're in the medical field. It doesn't matter what area you're in. You will probably be called to be a part of it, even if you're just being an active listener. But chances are, as your role increases and as your skill set increases, you'll be taking more leadership roles in these. So absolutely, pie charts, statistics, and stuff like that, you will be talking about. Am I super savvy at those? Absolutely not. But I am aware of them and I can articulate and work with them. I know the information that needs to be done. I don't have to make a pie chart. I give them the information and somebody else makes the pie chart. Actually, I can make a pie chart now, but um, it was easy to learn once I learned how. But again, these are things you need to be aware of. Knowledge of healthcare systems and regulations. You need to know healthcare policies, terminology, compliance, laws, HIPAA. You can't say things out of turn. You can't misspeak. You cannot raise your voice and sometimes yell somebody's name down a hall. You have to be very mindful of who's in a room with you and who is listening. Also, customer service and patient relations. I think everybody should have to do fast food. Now, fast food isn't what it used to be, but it is the best way to learn public relations and patient relations. Um, Positive attitude. I keep saying that because I can't emphasize it enough. It's very important. Educational tips, just to kind of wrap up. It's really important that you're constantly learning and increasing your knowledge base. So you have the opportunity while you're thinking and contemplating. And if you find an area that you want to specialize in, start reading, really robust newsletters. Don't look for fluffy ones. Look for ones that give you the information you need. And also push yourself to read ones that are outside your knowledge base. I go in and read medical journals all the time, and sometimes I only know half of what's being talked about. And yet, there'll be a few things that I can take away. So it's important to be able to do that. Join groups that have value, like our CCO Club and Facebook groups. We have Facebook groups, and there's some really good ones out there. Be careful with groups. Make sure you have one that is doesn't have a lot of fluff in it, I guess I could say. Take ancillary courses, medical terminology and anatomy, pharmacology, physiology. Those are important. And those are things that you can do in the beginning that's not very expensive and yet has a lot of value and bang for the buck. It'll, uh, all those courses that I took in high school and early in my career, I still rely on that knowledge. Learn shortcuts for Excel. You will absolutely work on an Excel a lot. Outlook, notes, all that those tips can be picked up on YouTube. You can learn shortcuts. Someone told me one the other day that I didn't even know. And network. You can never network too much. Be willing to meet new people. Now, within our industry, we have who people that hold your credential a lot of times have meetings, and you can be involved with those people that will also mentor you. But networking and always uh, putting your best foot forward, because you don't know who's going to walk uh, across your path that may be a potential person that will hire you in the future or offer kind words about you. They had a good experience when they met you. That can pay off. Look for jobs that will allow you to learn while you work. Those ones that I mentioned in the beginning, early in my career, I would go back and do any of those again. Well, not the ones that I had to stand for a long time. I don't think I could do that anymore. But I really enjoy those jobs. And some of them I didn't enjoy in the beginning. It was intense, some of them, but uh, I stuck to it and I got better at it. And I really valued what I learned. We do at CCO offer some courses that could be beneficial on you getting those first stepping stone jobs, or even to see if it's something you really like or don't like. You absolutely would want to take a medical terminology and anatomy course. This is basic, again, for any medical career, and it's a great place to start. And it's just beneficial to you, period, to know, have a better understanding when you go to the doctor's office or when you take your kids or your parents as you get to a certain age. Pharmacology has helped me immensely. We have a really fun pharmacology course that has no fluff in it, and it's helpful in everyday life. Somebody talks about a medication, I know exactly what they're talking about. There's new medications all the time, and I'm still learning. But just when you see those uh, commercials on TV, I know what they're used for. So that's helpful. Pathophysiology, again, how does the disease process work? What are different disorders that a person can have? These are fundamentals that you want under your belt that's going to make you better in the medical field. We also have a new course that is we call it QPen, but it's a qualified patient illness navigator. This is a perfect course if you are already a CNA, an EMT, or you've got a little bit of medical under your belt. This is a position you could be hired for in in a hospital, but especially in a large doctor's office practice, because of the ability to um, help be a liaison with the clinicians and the patient. So if you have good interpersonal skills and people skills, this with a good knowledge of the medical field, this would be a great role to get into. But I wouldn't encourage you to start off here. This is for people that have a little bit of a medical background under their belt, already have the anatomy and terminology, and understand the disease process. Uh, but a QPIN role is, again, like a little bit of a social worker type liaison, and it's a lot of fun to be involved in it. I would encourage you just to check it out, ask questions about it, go to the CCO.us, and there's a place that you can ask questions about this credential. What we're looking for in the future at CCO, we have a lot of things happening, but every month we have our Q&A webinar. The next one that we'll be having is documentation detective for incomplete medical charts. If that's something, the CDI aspect is an area that you're needing help with, we'll be talking about that. And we also are in the throes of our ICD 11 webinar sponsored by Find a Code. The next one is on cell rebellion, neoplasms, and tumors. This is the second chapter of the ICD 11 code set. So feel free to join us there. CEUs are available for all of these. And if you have any requests, something that you want to hear us talk about and unpack, let us know. It's real easy to find it, cco.us/topic. And that's it. Don't forget, we love to learn, and we want you to also be encouraged to learn coding and billing, a foundation of what we do at CCO, but we really have a lot of other opportunities. Take some time to look down. And like, thanks for joining us, guys. If you haven't already signed up for the CCO Club, go to cco.us/club. I did it, boy.
You did it. I was concerned you were going to go for a little bit longer, but well done. We got a couple questions. You ready for them?
Mm-hmm.
Here's the first one. Shamika asks, what specialties would you recommend to code in to gain experience to move up within the revenue cycle field?
Family practice. Absolutely. Family practice exposes you to all age groups. It absolutely, in addition, gives you experience with different CPT codes that you might not see in other areas. When you start getting into other specialties, then there may be, it's repetitive. So the other diverse areas might be, say, cardiology, because people, if they have cardiac issues, they'll have a lot of other issues, health issues as well. But I would say palliative care, hospice, home health, and family practice would be the number one thing to get into. If you're new to coding, a lot of times they'll start you in radiology and maybe emergency medicine. But family practice is going to give you the best exposure, in my opinion.
Gotcha. Next one. Just a comment. I work in mental health and we still have paper charts. You mentioned something about paper in
Yes.
when technology breaks down.
Yes, that is an area. Behavioral health and mental health is a little unique, and they have other rules and guidelines that are different because you can have group sessions as well as private sessions and so on and so forth. Um, I know that this mental health and behavioral health has gotten a lot more love through the years in the last 5 years to last decade than ever before. So there's a huge need for people to get into mental health. My sister-in-law works for a large mental health practice, and she absolutely loves it. She had a long time career in another area, and she had the opportunity to uh, cross her path, and she jumped at it, and she said that she is thrilled that she did that. So um, I would say if you're working in mental health, brilliant. Always be in need, and there's areas you can grow in mental health, and you will do a lot on paper, but um, billing and everything ends up being in an EMR system. If you want to get paid, you have there is an EMR system that's involved.
We got one more comment. Just want to recommend to everybody just check out the chat for those who are with us in StreamYard because your CEU link and password is there. Copied in a couple times, so make sure you grab that before we end. And the last comment is not from Kamika. I think it's this one. Yes. Another one from Tamika. I
I
started as a
sure.
mental health tech many years ago, which taught me how to deal with all types of people. You mentioned that a lot today.
Yes, that I did the same thing, and I said I did real estate for a while too, and I said, I don't know which is worse, sick people or rich people, because their personalities are extreme usually, and a disgruntled rich person or a sick, an upset person. Again, having that exposure to be able to do that really will help you. Um, you can take classes on where they give you practice pushing you into scenarios, or even like take a drama class, something like that that really helps you. um, Personalities. You can learn personalities about that online. I do a lot of research on that, and there's books and there's great videos about that. But yeah, that you are absolutely right, Tamika. There was another question that came up that wanted to know where to get started in pharmacology. Honestly, guys, I would start with our pharmacology course. I was an integral part of putting that together, and it's brilliant. The textbook we use is fabulous, and I would encourage you, even if you just want it for personal knowledge, pharmacology would be a great way to learn about everyday medicines and over the counter medicine and natural medicine. Mm.
Awesome. I'll copy the CEU link in there. There's a couple people were looking for it. And
Yeah.
yeah, there's the pharmacology one. Gotcha. Okay, great. So thank you everybody for being with us tonight. Any parting words here, Alicia?
The medical field is a great industry to be in, and it gives you a skill set to do almost any other career. So it could be a stepping stone to something else that, like Tamika said, learning personalities and dealing with people in crisis can help you in your future. But, and it also fast tracks you on soft skills. So I encourage you. It's an area that I'm passionate about, but I've had other careers in my life. I've always gone back to the medical field. Uh, and if you have any questions, find a mentor, ask people their opinions or what they think you would need to be better at a career in the medical field, because that person may know you and know your faults and what you are good at, and they would be honest with you, I would think. So again, encourage you. I hope you become passionate like I am about the medical field. There's not enough people in the medical field, and it's a lot of fun to meet people. You become a family when you're working in the medical field with your coworkers. That's it.
Well said. Thank you so much, Alicia, for sharing your knowledge and experiences and all your little stories tonight. I really appreciate that. And I'm sure all the people on our stream here today as well appreciate you. So that wraps us up, I believe, for this evening. And we will talk to you probably another 2 weeks for our Innovi Health for Find a Code ICD 11 webinars. So until then, we'll see you soon, I hope.
Bye, guys.
Take care.